Namaste and welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We were discussing Shwas Vyadhi and we have discussed Shwas as a Kulaja Vyadhi. I put forward my opinion that how we can not prevent but at least reduce the intensity of Shwas Vyadhi in the next generation. In that regards, I have discussed you 2 points. First, the couple who wanting a child and having a family history of tamakshwas in either family, husband or wife, both should go for the panchakarma for Deha Shuddhi and as well as Bija Shuddhi as described in the Ayurved. First thing. And secondly, we can start Rasayan Chikitsa, which is which gives strength not only to dhatus but also to the srotas or a particular organ in the body. For Rasandravya, I have discussed you can decide depends on your patient in front of you like Pippali, Abrak, Suvarna Kalpa, Vasanta Kalpa, any other thing, and you should start the Rasayan Chikitsa right from the beginning when the couple is uh, trying for the child. After conception, before conception, you should give Rasan Chikitsa to both the couples as Shukra Bij and Ashukra and Artho both should be in a good strength, and after conception, the Rasan Chikitsa can be continued to the wife only and it should be given to the till the delivery. Now always remember when you are choosing any Rasayan Dravya, particularly which is acting on the prana or srotas, you should also keep in mind about the indications and contraindications in the pregnancy, which is equally important. Now, third thought about this is as we are giving Rasayan Chikitsa to husband and wife and after conception to the wife only till delivery, when you are choosing the Dravya of Rasayan, we should keep in mind that it should be beneficial to the baby in the womb. So, I will give you example. In the pregnancy, first trimester, it is a tradition that we give Lugumali Vasanta for overall growth of the body, then Madhumali Vasanta, and then Surnamali Vasanta in the third trimester, 3 months, 3 months, 3 months. Now, Vasanta Kalpa, as given to the good growth of the body, they will also have a good action on the pranavasrotas of the child which is growing in the uterus. So, when you are deciding any dravya for Rasayan Chikitsa, you can think of both mother and baby, so both will be benefited. Now, there is another aspect of the Rasayan Chikitsa. In last episode, I told you that we should choose the Rasayan which will give strength to the Pranavasrotas. First thing. But you should also think of the Rakta Dhatu also for the Rasayan Chikitsa. Why? Because when there is growth, the lungs get developed. In Ayurveda, they have specifically mentioned that Shonita Fena Prabhava Fupusa. It means in the development of the Fupusa or lungs, there is a major role of Rakta Dhatu. So, when you are giving Rasayan Chikitsa, along with the thought of Pranavas Srotas, you should also think of the Rakta Dhatu like Sariva, etc. So, in Rasayan Chikitsa, think of Rakta Dhatu for the development of the lungs and think of Pranavasotas that the developing Pranavasotas will get the strength right from the beginning. After the birth of the child, the Rasayan Chikitsa should be continued to the baby. See, when we are saying Rasayan, it gives strength, there is no time limit described that in how many days it will give the strength to the baby or any person. So we should continue the rasayan chikitsa to the baby after birth also, so that developing body of the baby will get enough strength to face this Kulja trait of the Shwas Vyadhi. So, Panchakarma before conception, Rasayan Chikitsa to husband and wife before conception, Rasayan Chikitsa to the lady or wife after conception, and thinking of baby also, and Ratta Dhatu and Pranasutas in this Rasayan Chikitsa, so it will give strength to the Pranasutas. And after birth, continue the Rasayan Chikitsa to the baby. Now, in all this time period, you should also ask that both couples that they should avoid Kledakar Ahar Vihar. So, the intensity of the clay in the body will not get increased and will not hamper our aim of Rasayan Chikitsa. After conception, the wife should follow this Ahar Vihar, and after birth, you should always think that you should watch that whatever food is going to baby is taking in the growing life should be less Kledakar. See, this is a very long term process, and for this, you have to counsel the patient well before starting the treatment that it is the time taking task. But for the benefit of the next generation, this is to be done. If the patient is really serious, he will follow it, and we can try the ray of hope on the basis of Ayurveda to reduce the intensity of this Kulaja Shwas Vyadhi in the next generation. Again, for how many days Rasayan Chikitsa to be given to the baby, there is no time limit. You should go on and on until few years to evaluate whether really the intensity of Shwas Vyadhi is being reduced or not, or what is the intensity of that Kulaja Vyadhi. So, this is the ray of hope only in Ayurveda for the Kulaja Vyadhi like Shwas. Now, these principles of Ayurveda which I have described you regarding Shwas are equally important for the other Kulaja Vyadhi like Prameha. We can implement same principles in the family history having Prameha Vyadhi. So, this is about the Kulaja Vyadhi, Shwas as a Kulaja Vyadhi and its management. I will be happy to have your suggestions and opinion on this what the lectures we have given under this new thought which I have put forward in front of you. Now, regarding this Kulaja Vyadhi only, I will discuss a very different topic in the next episode, which is very essential in today's era. Thank you very much.